very Claire, and today I would like to talk about something that is often so overlooked but so important: sexual health, especially for those of us living with sickle cell disease. Living with sickle cell brings its own set of unique challenges, and our sexual health can sometimes be impacted in ways that aren't always easy to talk about. But sexual health is important and very crucial to our overall well-being. That's why I believe it's important to have these open conversations and not be ashamed about it. So what is the impact of sickle cell and sexual health? Well, I believe that fatigue, pain crisis, some of the medications that we take can affect our sexual desire and how we feel about being intimate. There may be moments where pain and extreme tiredness can make sexual activity a bit difficult. And for some of us, fertility can be a bit of a concern, which is something that I have talked extensively on my channel. But I want you to know that as much as your sexual health might look different living with sickle cell disease, you have to be kind to yourself and be able to recognize that even though your sexual health may look different, it is so important and valid. The key to managing sexual health and sickle cell is to have open conversations with your partner. I know sometimes it might be difficult to even explain how sickle cell affects you, but it is important to talk about how you feel, what your body needs, and when you are comfortable being intimate. Sexual activity is very crucial. It might even be planned for when you are feeling stronger or more comfortable. And sometimes sex is not necessarily the only sexual activity you can have. Maybe just a touch or just a hug might give you some sexual or emotional connection. Try some of these things, you might be surprised. But what I always say is go for how your body feels, talk with your partner, and have open conversations of when you are comfortable being intimate, because your body needs it and you need to know and understand your body. As with everyone, practicing safe sex is very important. If you are someone living with sickle cell and you are sexually active, using contraception and protection against sexually transmitted infection is critical, because if you get a sexually transmitted infection and you've got sickle cell, their complications can be more. So you need to bear this in mind. Things like pregnancy, for example, there are more risk and more complications for women with sickle cell disease. So you need to put extra thought if you want to get pregnant or if you are practicing unsafe sex. There is a possibility that you can get pregnant. So you need to bear in mind, if you are practicing unprotected sex and the chance of you getting pregnant and the complications that come with living with sickle cell disease, you need to bear all of this in mind. I have talked about my pregnancy journey and lots of the complications that I had, but with care and open conversation, you will be able to get the support that you need. This shouldn't scare you. It's just for you to put extra thought and care into you getting intimate living with sickle cell disease, because if you happen to get pregnant or happen to get a sexually transmitted infection, there are so many complications that come as a result. So you need to bear that in mind. Managing pain and intimacy. Sexual activity can sometimes be a trigger during and after a sickle cell crisis for some people with sickle cell disease. I mean, this means that Managing your health during these times is very essential. It might also mean that you have to engage in less physically demanding sexual activity, and also find ways to connect with your partner in ways that will not put so much strain to your body and bring you less complications. I know it's easier said than done, but it's important to understand your body, and you need to know when any form of sexual activity brings you pain, and you need to be able to communicate this. Find a way to communicate when your body cannot take it anymore, or when you feel uncomfortable. I know it's easier said than done, especially when you come in sometimes. Sometimes I am in a crisis and I come in looking so fine, and the next thing you see, beep, yes, he wants to do it, but your body doesn't let you do it. You need to be able to communicate that. And if your partner understands you like mine does, he will know that, okay, at this point in time, I need to go easy. I need to take it easy. You need to be able to communicate this with your partner, because as much as it's difficult for you, his needs also need to be met, but your health always need to come first. If you think you can physically and emotionally be able to do it, communicate that. If you cannot, communicate that. I always say communication is the key, because if he doesn't know, he will not understand you. If she doesn't know, she will not understand you. So it's important and crucial that we always communicate how we feel. I will finish off by talking about mental health and sexuality. Chronic illness can take a toll on how we see ourselves, our sexual desire, and identity. If pain, fatigue, or tiredness is affecting how you see yourself, it's affecting your body image, your sexuality, I will encourage you to talk to someone, be it your doctor, a medical professional, a mental health professional, or even just a friend, because it is important to have these conversations. As difficult as they are, your sexual health is a crucial part of your well-being. I have talked a lot about my journey with sickle cell disease, but I don't think I have talked about how sickle cell disease has affected my sexuality and my sexual health. And this is just the beginning of these conversations. There are things that we are going to dive into in more detail, but I thought it's important to start this conversation. If you are somebody that is living with sickle cell and you are struggling to have conversations about sexual health, sexuality, please drop a message down and let's talk about it. I believe that if you understand how you feel and you find a way to communicate that with your partner, you will have a better sexual health, because that has worked for me. When I became sexually active, it was of course a bit more challenging, because I was still trying to understand my body. I was still trying to understand how sickle cell affects me sexually. And it's also easier if you stick with one partner, not having to explain. But of course, that can be difficult. But it's still important to communicate with your partner. Communicate how you feel. If you find yourself wanting to get intimate, communicate that. Because some people, I have heard, some people being intimate helps them with the pain. Having an orgasm helps them with the pain. Having these conversations is very important because sexual health is part of our overall well-being, and every single human being deserves to feel good in themselves, be it mentally, physically, and sexually. So let's continue this conversation and keep safe. Thank you for watching. Please do not forget to subscribe and share this video. If you know anyone that lives with sickle cell, please share this video with them, and please drop your comments about your experience about living with sickle cell and sexual health. Thank you for watching. Goodbye.